What's up, guys and gals? It's Ken Wimberly back with you today for another wow moment discussion. This one again is on the not so good side of wow moments, and it's probably something we've all dealt with. This is relative to the medical industry and just how out of whack it continues to be. I'll start by talking about just health insurance in general. And my health insurance year over year, probably much like yours, was just going up, up, and up. And I was to the point where for a family of 5, our health insurance was pushing $1,600, $1,700 a month. I mean, that's a lot of money. That's $20,000 a year. We're paying for health insurance and we're a healthy family. We don't get sick that often. We take care of ourselves. We're a pretty healthy family. $20,000 a year paying for that. So that was not working. And fortunately, I had a friend talk about something that his family had done a year or two before. They moved to a HealthShare plan with a company called Zion HealthShare. So I checked out Zion, and about 2 years ago, I moved our family over to Zion HealthShare. It's a great model. So Zion, I would put on the wow side, on the good side. But what I'm going to talk about today is what happened on the wow side, on the bad side. But Zion is pretty great. And so Zion cut my health insurance costs from, again, almost $1,700 a month down to about $850 a month. So basically cut it in half for health insurance. But what Zion is, it's not typical and traditional health insurance. What it is a HealthShare plan, and how it works is kind of like the old major medical plans used to work. They pay for one well visit per year for each person in the family. And then you're on your own to pay for any incident up to the first $1,000. So the vast majority of what we experience is less than $1,000 per incident. So for instance, you get sick, you need to go to the doctor, you need to go to the urgent care clinic. So maybe it's a couple $100. You go and see a doc, maybe you get a shot, maybe you get a Z-Pack or something like that, and it's $200, $300. Well, that's under $1,000, so that's on me to go pay as a consumer, to go pay for that. So I will go and tell them, hey, I'm a private pay client, go and pay out of pocket. So again, have some minor incident, anything I need to go to the doc for, anything less than $1,000, it's on me and out of pocket. Once I hit that $1,000 threshold per incident, then Zion picks up and pays for the coverage. So example of that, last year our son fell and broke his arm in January, and it was a pretty severe fracture. I mean, it was bad. It didn't require surgery, but it required an ER visit and multiple follow-ups with orthopedic docs to make sure everything was going okay. And that ended up being considerably more than $1,000. So we picked up the first $1,000, Zion paid for everything after. But do the math. Like if I'm saving $10,000 or $9,000 or $10,000 a year from paying half of what I was paying in insurance to Zion, and then I have 2 or 3 incidents a year that cost $1,000, I'm still way in the black on that. So, all right, so there's Zion. I'm a private pay. I go and have a private pay visit. So I went to see my doctor this year, whom I love my doctor. I've seen him for years. He's an incredible doc. He's a DO. Really like the guy. But he's with a major network. I'm not going to talk about who the network is or he's with, because I don't want to throw any particular group under the bus, because I know this is kind of an across-the-board thing. But I went to see my doc this year, and annual checkup, go over all my blood work with him. I do my blood work prior to going into the visit, so he's got it. We can go over everything. And the nurse brings up, says, hey, you had your shingles shot a year or 2 ago. You haven't had your follow-up second dose. Do you want to get that? I'm thinking, I definitely don't want to get shingles. I've met or talked to a couple people recently that had shingles and it sounds miserable. So I'm like, yes, I want to go ahead and get that second follow-up shingle shot. I didn't think about price. I didn't think about anything there. I honestly didn't cross my mind that there would be anything out of line when I got the shot. So get the shot. And then a few weeks later, I get a bill from the doctor's group. And it says, I owe $655. And I'm like, what on earth do I owe $655 for? I said, I was private pay. So I already paid, I think $150 something when I went to my visit for a private pay checkup visit. And then as out of pocket, which that's what they told me. I said, hey, I'm private pay. How much do I owe for this visit? They said about $155. So I paid that when I went to the visit, and then I get a bill for $655. So I call them up. I'm like, what on earth are you billing me $655 for? And they said, oh, you had a shingle shot. I said, are you kidding me? $655 for a single shot. So then I go and start doing a little research, and I'm researching. Thank you, GPT, for your help on research. And then it links me to a bunch of other sites. So I'm doing a deep dive in research, and what I find is that this cost for each shingle shot should be no more than $250. I think the manufacturer's recommended price on this is $215 for the shot. There is sometimes an administrative fee for the nurse to administer the shot, and I think my provider had a $40, I believe, administrative fee with a $12 discount for private pay, so $28. That's fine. I'm fine with that. But the $655, oh, by the way, the $655, that's the private pay discount. Their actual, what they're gonna try to bilk insurance for is $936 they're gonna charge for that shot. Again, manufacturer's recommendation, $215. Nah, we're gonna go ahead and charge $936 for this shot. Absolutely ridiculous. But since I'm private pay, I get the discount, and it's $655. So no way am I gonna pay that bill. I've been disputing it. I've called them. I've told them. I've said, I've done the research. Here's what it should be. I'm willing to pay the average. I'm willing to pay you $250 for it, but I'm not paying $655 for your way marked up private pay discount. So we're in this debate right now. We're going back and forth. We're going to see how it works out. I don't know how it's going to work out, but I can tell you I'm not paying them the $655 for this. It is absolutely ridiculous. It's crazy. It's what's wrong with our healthcare system. So if you've experienced anything like this, let me know. I know I'm not the only one. I know there's others out there every single day that are getting hit with things, and I'm sorry that happens to you. I'm sorry it happens to me. It's unfortunately the way things are right now. Things like Zion and other HealthShare programs are certainly helping me to save a lot of money every year. But let me know what's going on with you, if you've got any other health system issues, and we'll continue pushing and doing what we can to put stories out, good, bad, and otherwise, about wow moments in this world. If you like this content, if you like to get other content on parenting, systems for life, doing hard things, wow moments, and laundry hacks, then hit the little subscribe button, follow us, get notifications, and we'll see you next time. Thanks so much.